Welcome and thank you so much for joining us today. My guest is Director Kieran Ahuja of the Office of Personnel Management. Director Ahuja, thank you so much for being here.
Yes, thank you so much for having me on.
Great. And we're here today to talk about open season. We know that this year open season will run from November 13th to December 11th. And this, of course, is the time of year that FEHB participants can make changes to their healthcare options. But we know that each year, information from the Office of Personnel Management shows that less than 5% of participants actually take advantage of this open window. This is something I know OPM encourages employees to take more advantage. Can you talk a little bit more about how OPM is leading these efforts to try to raise awareness around open season and encourage people to take a look?
Yes, absolutely. And the first part is thank you very much, Drew, for having me on. This is part of our campaign to get the word out to federal employees. So really appreciate you all helping us with that. I think it's really important this time of year. Maybe part of the reminder is we're going into a bit of flu season. We're cognizant of those wellness checkups, especially around our flu shots. I think likewise, we really should be doing an annual check on the type of health benefits that we have, especially through the FEHB plans. And I think we realized we were quite shocked when we saw that less than 5% of our FEHB enrollees actually go back and look at their plans to see whether those plans work for them. And I think, again, our lives evolve, they change, different set of circumstances. And we try to provide so much information out there that I think sometimes, and listen, I was one of these federal employees, was like, I'm pretty good. I'm just going to let my plan roll over, not that much work for me to do. But we really are encouraging our folks to be proactive. We have information, rating, customer service ratings of plans online. We have ways that you can compare plans online. There's just lots of information that we want folks to take advantage of. So we can increase that participation, or at least the participation of going through the review to make, and if your plan is great, that's good, but we want to see more activity on our website to make sure that folks are taking advantage of those materials.
Absolutely. And I can totally understand what you mean. There's so many options out there, so many things to think about. I'm not a federal employee myself, but I can understand why it might be a little bit overwhelming. So maybe you can tell us a little bit more specifically, what are some of the available resources on OPM's website and what might participants want to be looking at?
Sure. So like I mentioned, we have results of customer satisfaction surveys that are available so individuals can take a look at those health plans, and also for the dental and vision plans as well as brochures that we have available on these plans. So it just provides a lot more information for enrollees. And the website is www.opm.FEHB compare. So opm.gov/FEHB compare. And likewise, we have opportunities to take a look at the vision and dental insurance program, which is FEDVIP at benefeds.com, so BENE feds.com, as well as FSA Feds.com, which I know we're going to probably spend a little time talking about as well.
Absolutely. And thank you for going through those. I think it is really important that everyone knows that those resources are out there and available to all enrollees in the FEHB program. And Director Ahuja, you mentioned as well that, sometimes even yourself included can take a look or think, maybe what I have is pretty good. Maybe I don't need to make a change. What are some of the benefits of taking advantage of open season, even if you don't make a change? Is it still important to even, look what else is out there?
You're asking all the right questions, Drew. Yes, I think, listen, this is not about you have to change your plan. This is about we want to encourage our federal employees and their families to do the due diligence, just to go back. Plans change. There are adjustments every year. There's certain things that we're asking plans to cover. So it's just worth going back and saying, does this plan work for me? Maybe there is a significant life event or an addition to the family or other circumstances that are important for you to spend time reviewing those plans. But even not, I just really want to encourage our federal employees to go through the exercise of taking a look at their current plan and actually see what's now available, because there are shifts every year.
Absolutely. And, I believe that there are plan brochures out there as well that kind of detail a lot of those changes. One other question I had for you, just on the timing of open season. I
Mhm.
mentioned at the top, it runs November 13th to December 11th this year. So is there a reason that federal employees should, try to think about taking advantage earlier and maybe not waiting until late, mid-December to take a look? How important is it to get on this right away?
Well, we create a period of time where employees have an opportunity to learn and participate and then also make those changes. I think generally it's just always helpful to do it on the early side. Certainly, we will see an influx in some of those changes that will happen towards the end of the season. I'm always reminded also that as we start to move into Thanksgiving and festive season, we're a little distracted for good reason. And so I think as soon as you're able to do it, I would say just knock it out before Thanksgiving and do that assessment. But oftentimes you're having conversations with multiple family members, or multiple conversations depending on if you're going to switch your plan or you think the plan works for you. I will say that less than 5%, like I said, do make those shifts. Again, this is not the only barometer, but I'm thinking, and my prediction is, the more we can encourage folks to look at those plans, we will see those changes, and we will see that number increase, or the percentage increase.
And is there also, a consideration of there may be cost savings available? Maybe it's not just your, you know, the types of coverages that you need, or maybe something changed with a doctor that you like or something like that. Is there also just cost savings that are available to federal employees here?
Absolutely, absolutely. I'm glad you mentioned that, because as I was sharing this, it was almost a given that yes, your health concerns might vary, but again, it is also finding a plan that meets your budget as well. And there are definitely cost savings to have, because again, if the plan is not something that you actually need, and these plans vary in pricing, it's always important to go back and check both for like health coverage as well as cost savings.
Yeah, no, absolutely. And I guess it's kind of makes sense to bring up here as part of the segue that there are premium rates rising. Of course, this happens every year, just inevitably. It's not just the FEHB program, all health insurance rises every single year.
Mhm.
But over the last couple of years for FEHB, there have been some pretty significant increases. So for 2023, for this year, enrollees paid 8.7% more on average towards their healthcare premium costs. And then for 2024, another 7.7% on average increase. So with these couple of years, I would imagine that federal employees or other program participants might be concerned about the cost of healthcare coverage. Is there anything that you can tell enrollees that might try to alleviate some of the worries here?
Well, I don't know if I can alleviate worries other than to say this is really an industry dynamic, and we trend very much where industry is. I would say actually, Drew, for 2024, we're slightly below similar sized employers, around an average of 5.8%. So less than 6%, but certainly it does vary by plan, and just another reason to see, right, where that increase might fall and whether you're feeling a little bit more of that pinch or burden with one particular plan versus picking another plan that might actually be more appropriate for you going into 2024. So you're right. It's challenging, I know, for our FEHB enrollees, and we're very mindful of that. Our team works very hard to find the right balance between providing the comprehensive coverage that our federal employees and their families have learned to expect and appreciate, coupled with the affordability of those plans. And that is something we constantly strive for, in the balance that we seek. So our barometer is, where is the industry trend? I think this time around in 2024, we do fall slightly below that trend with similarly situated or sized employers.
Yeah, no, absolutely. And I've seen the data there as well. And that definitely makes sense. Of course, as I said, there's no um, we can't always adjust that or like, it's something that might happen, but as you said, another reason just to take advantage or at least take a look during open season.
Yeah, I would say
Um,
even more of a reason, frankly, as cost of drugs are going up. We want to ensure that our plans are comprehensive. Certainly, we've had pay raises in the past couple of years that helps offset, but we are mindful that those gains then become somewhat limited, right? As health care, health insurance premiums go up.
No, absolutely. And one other thing I want to bring up here, which maybe would help with the costs a little bit. I know it's another part of the
Mhm,
whole health benefits program that OPM works on, is the federal flexible spending account program, or FSA Feds. I know you mentioned this a few minutes ago
mhm,
and
mhm.
accurately predicted that it's something that I wanted to talk about a little bit more in detail. So do you have any numbers around, how many participants actually take advantage of FSA Feds, and is this something OPM is encouraging more to consider?
Absolutely. So I was looking to see that, again, not a number that where we feel where we're satisfied. We have
Mhm.
20% of our FEHB participants who actually use the flexible spending accounts, and that is something that we want to make sure our federal employees are taking advantage of, whether you're an FEHB participant or not. So in my case, I happen to have my husband's insurance at a different employer, but I actually take advantage of FSA Feds because, well, in some ways, he uses his FSA Feds or version of that and our healthcare, kind of flexible spending account, and I use mine. And it really is a great way to take advantage of the tax savings. About a 30% tax savings when you determine the amount of your out of pocket health expenses, whether it's for the FEHB plan or if you have dental or vision insurance. I use it to cover my dental visits and prescriptions and lots of other things. It's actually, I'm quite surprised every time I go on FSA Feds and go, wow, we cover that. I did not realize it. So again, I think the theme here on this broadcast is just take a moment to check and see, because you're leaving money on the table in a lot of ways, because this is money you can take advantage of. These are opportunities you can take advantage of pre-tax. You can use that towards out-of-pocket expenses, which we all have. Uh, and if you're going to spend the money anyway on these expenses, why not do it in a way that gives you some tax savings?
Yeah, no, absolutely. And just about the FSA Feds, one quick point of
Yeah.
clarification. So correct me if I'm wrong, but is this something that employees, if you had, or if you were part of FSA Feds for, let's say, 2023, is this something you have to kind of re-enroll in or restart up the next year, or is it something that rolls over?
Well, you have a certain amount that does roll over to 24, but you have to elect what is the amount that you want pulled from your paycheck. So that will shift every year. And so the presumption is that, let's say for 23, like for myself, I've spent through that. And so I may have a little bit left over that can carry over. And I know I'm always planning to make sure that if I do, that it's within the required amount. But if I want to take advantage of it for 24, I do need to elect what that dollar amount is that I want pulled from my paycheck in order to take advantage of the tax savings and use it towards prescribed health costs that I know that I'll incur during the year. Oh, and I
Yeah.
should mention, you can use, we also have both the healthcare uh, flexible spending account as well as dependent care. So it's an opportunity to take advantage of childcare, elder care expenses. So these two counts exist. Again, I keep on getting shocked by the numbers that only 20% of our enrollees are FEHB enrollees that take advantage of this program. And they really are nicely coupled together so that if you have some of these out-of-pocket expenses on plans, maybe you'd like to get a more inexpensive health plan, so it's a lower premium cost, you could take advantage of the FSA Feds for some of those out-of-pocket expenses.
And is this something for FEHB enrollees where, do you have to look in two different places if you're looking to change your healthcare options for FEHB versus FSA Feds? Is that a separate website, or is that something you can do like all in one go?
So the FSA Feds is a specific website for those flexible spending accounts. And then it is an election for FEHB plans that you do through your agency.
Gotcha. Thank you.
Mhm.
So something else I wanted to bring up here as well. We talked a little bit about FEHB, FSA Feds, but there's also another program for dental and vision coverage, the Fed VIP or Fed VIP
Mhm. Mhm.
program, however you want to say it. So are there any, big changes for this program this year? I believe that there was some eligibility changes this year, or anything else that federal employees should keep in mind for dental and vision plans specifically?
Well, I think we have them, and I know that there's been some shifts in like there are with our FEHB plans as far as like number and type of plan. So we just encourage folks to go in, especially if they either have a plan, so make sure that they have the right plan for themselves, or they haven't necessarily taken advantage of a dental or vision plan. Maybe they've only had an FEHB plan, haven't thought about the vision and dental. It is a little bit of work, right? Because maybe you had certain coverage with certain FEHB plans. Maybe you're scaling back on, and with one particular plan and can lean into a dental or vision plan. We know that the premium increases for the dental and vision plan tend to be a lot more modest than the FEHB plan. So that's something for folks to think about as they determine like what their cost for their family, the vision and dental costs, of whether it's a good deal for their family to take advantage of those particular plans, just because those premiums tend to be experience much more modest increases over time. And Drew, I did want to mention that we do have a very exciting announcement related to this open season, which is a major expansion of the dependent care flexible spending account, which is now we're going to be offered to active duty service members. So this is something that will go into effect at the beginning of 24. We've been working in partnership with the Department of Defense, and it's expanding eligibility to eligible military personnel, active duty, and also those a part of active guard reserve on Title 10 orders. So very specific about that. And DoD estimates it will potentially impact about 400,000 service members who have eligible dependents. So it's a very sizable population. I want to make sure that your listeners and viewers know that this is a new program that OPM will be administering.
Is that something that you guys had in the works for a few years, or where did that change come from?
And yes, thank you, Drew, for that question. It's in line with a directive found in executive order around advancing economic security for military and veteran spouse and military caregivers and survivors, which was earlier this year to establish these flexible spending accounts.
And is this something that was available to civilian employees already, and this is just an expansion of that
Exactly.
program? Correct?
Exactly. Mm-hmm.
Is there any estimate, and maybe you don't have the answer here, but any estimate on how many, if you have 400,000 people eligible, how many people might actually enroll in the program, or do you foresee any big uptake there in 2024?
That's a good question. I really don't know. That might be a little above my pay grade, but I'm hoping that we do get a significant uptick. And I think a big part of that is getting the word out, since it is the first year. My hope is that we'll get fairly sizable adoption, just because it is a very useful tool. And I know we all as families have dependent care expenses, and it is something that was of importance to this administration to be able to offer that to the military personnel as well as civilian side.
Yeah, absolutely. And, speaking of trying to get the word out, we talked a little bit at the top about how OPM is trying to, encourage more people to take advantage of open season. Something else I was kind of curious about is is there some sort of partnership that you have with different agencies to try to encourage participants directly, whether you're at the Department of Energy, for example, or the State Department or wherever else? I mean, are there teams within different agencies that OPM works with to try to really encourage people to think about open season?
That's a great question. We tend to issue announcements directly to agencies uh, through what we call like more formal memos back and forth to agencies, and really just reminding them of the importance of getting this information out and the requirement that they should. I think what you're posing is also a good question as far as outside of the normal course of like making your employees aware, like what more can we do collectively? I know that we talk about it within our Chico Council. We have a number of different practice and community of practice groups. And we are trying to get the word out, certainly through media, but as well through some of these forums. And I think a big part of it is really maybe more of the shock value. We only have less than 5% that actually change their plans. And so we are a bit worried that individuals are not taking advantage of the variety of 60 plus carriers, more than 150 plans. There are lots of choices. That number may obviously vary depending on where you reside in the country or in one of the territories. But our hope is that just kind of really pounding the pavement and making it known that I think sometimes there's frankly, Drew, a presumption that people are doing it. And so the data just really shows that there's more work we all need to do.
So it's just to clarify, 5% who actually make changes. Is there any data on how many people take a look or even just open some of these links, but not necessarily make a change or make a different option?
Unfortunately, I don't have that data in front of me. I do know that we'll have some of the like website activity data that we can take a look at, but that is the most concrete information that we have versus just activity that comes on via the website, that it's a little unclear if it's related to. We know there is a general uptick in open season and viewing some of these pages on the website and taking a look at the plans, but unfortunately, our team doesn't feel like that's like the best statistic to determine like those who actually were close but didn't, or determined that they didn't take advantage of open season. I know we just also issued our federal employee health benefits survey to a number of federal employees across the federal government. And so some of the questions do focus on choice of plans and variety and whether you think the plans serve your needs. So it is actually, you're making me think whether this is a good question. I will go back and check to see whether we specifically ask whether you've gone to look at your plan and determine whether it's the best plan for you going forward.
But I wanted to dive in a little bit more on FEHB specifically. I know there's a lot of new things going on, a lot of new requirements and coverages. So maybe if you can give me a few top level, changes that we're going to see in FEHB in 2024.
Absolutely. So like I mentioned in the first segment, we often are ensuring the right balance around the comprehensive nature of the benefits we want to provide through our health benefits program, as well as the affordability. It's a unique but challenging, I think, perspective and opportunity, just being the largest employer-sponsored health benefit program in the country with more than 8 million enrollees. So you can imagine kind of wide kind of set of individuals who participate in these plans. And for this particular season going in 24, really we've asked our carriers to focus on a few different areas. One is around maternal health, ensuring they're providing the robust set of services under maternal health, as well as mental health and substance use disorder services. We've asked carriers to focus on the comprehensive nature of providing gender affirming care, and also an expansion of assisted reproductive technologies, which we know is important. One fact I do have related to the benefits survey is that we know that federal employees under the age of 40 do very much appreciate the benefits and also the leave that we provide as part of the federal government. So we do know that these type of benefits, including the leave, make a difference for federal employees and make a difference around the retention that we want in the federal government.
And those survey results, we don't have to go into all the details because I know it's not something that you might have off the top of your head, but at least from, maybe a top line perspective, are there, do you take those survey results and consider what federal employees are telling you to make changes to these like coverage options, or where do the ideas come from for focusing on maternal health or infertility or things of that nature?
Well, it's a mixture of data points, certainly the survey, certainly the interest of our partners on the Hill, priorities in this administration, where we're seeing the trends in healthcare itself. So we want to stay competitive. So if we see that there's an uptick in these services in other parts of the market, there's a general feeling and expectation, which is absolutely legitimate, to make, the FEHB should also be in line. And then frankly, whether kind of slightly in front or not too far behind, and following those trends of coverage in the healthcare industry space.
Yeah, no, absolutely. And it's something, it's always interesting to see each year, what OPM is going to be shifting or how carriers are going to be shifting every year. That's something that, it's never static. It's always changing every single year.
Yeah, absolutely. And, I think for us as well, there seismic events like the pandemic, which put more attention on mental health. So to your earlier question, Drew, about what are those data points, they really do come in from different places. And I think our team spends a lot of time thinking through what we call our call letter to carriers, which lays out our priorities, ensures that there's a balance of giving them time to actually increase the adoption of services or coverage that we want in a particular area, knowing what they may need to manage from year to year, balancing what this might do to the overall premium and cost of the FEHB plan, and again, looking at the trends that are taking place across the healthcare industry.
Absolutely. And speaking of maybe seismic changes, I know that there's another big change coming
that's
up.
I like that segue.
Good segue there to the Postal Health Service health benefits.
Yes, I knew that's where you were going.
So this is a program for Postal Service employees. It's going to be launching next year. So we're not going to see anything in open season this year. But how is OPM already ramping up for the launch of this program? And are you anticipating a really, kind of interesting open season next year?
Well, Drew, I think you picked the right word, which is this is very seismic for OPM and for postal employees, annuitants, and their families. This is a wholesale shift. I mentioned that on any given year so far, less than 5% switch their plans, their FEHB plans. For the stand-up of this program, literally 100% of all these employees have to move from an FEHB plan to a postal health benefits plan, so in a separate program. And the reason why that program, as you know, being kind of pulled out and separated is to ensure the Medicare integration and other cost savings to the Postal Service. And so we are kind of in the throes of standing up that new program. In many ways, Drew, we're using this as a test model to do some of the modernization that we want to see in the FEHB program that we're testing in the Postal Service Health Benefits Program. So more a centralized enrollment, using more automated features, having a decision support tool, things like that, that we think will be actually really helpful for individuals in determining what's going to be the best plan. We've now just moved through determining which carriers are going to be in that plan. It is really like a very long runway getting to open season, which will be the latter part of 24. So nothing to do now, but it's a good kind of signal that if you are a postal employee, annuitant or family member, and hopefully you've already been hearing about this because we've been communicating this as much as we can, that later in 24 will be a time to really pay attention and make sure that you're taking advantage of the open season to determine the best plan for you.
Yeah, no, it's absolutely going to be a really interesting thing to watch roll out. I like that you mentioned that, you might take some of the things that are happening in PSHB and maybe consider them for FEHB. Is that just going to be kind of, wait and see how this rolls out and maybe where some of the pain points are? And then, I mean, how likely is it that some of those things will be incorporated to FEHB later down the road?
Well, our hope is, this program FEHB is 60 years, about 60 years old, and we want to make some modernization improvements to that program. And the Postal Health Benefits Program gives us an opportunity to use it as a test case with a much smaller group of enrollees. So it really is, of course, both in the benefits that the Postal Service and those employees will receive with this new program, but also helping us do some testing on some of these modernization features. This is something we're very hopeful, and we do want to implement. It will of course depend on the partnership with Congress to make sure that we have the resources to do that.
Yeah, absolutely. Well, I'll definitely be watching. I'm sure a lot of
Okay,
people
good. Yeah.
going to be paying attention to this, so we'll have to see what happens. But switching gears back to this year's open season, we talked a lot in the first half about that just 5% of the FEHB population make changes during open season, and you've been encouraging a lot of people to take advantage when or if they can. So just from your mind, I don't know if you have a number or just an idea of, what would make a successful open season to you?
Well, certainly looking at the activity, the increased activity on the website, that individuals are taking advantage of all the materials that are available to them. And I would say, for me, in my mind, being able to double that 5% so that there's a 10% of, 10% of our enrollees are, switching plans or taking advantage as plans have shift. Certainly, because we're providing additional services in different areas, I think sometimes the thought process is, and again, I have been there as a federal employee, is that they stay the same and they stay static. And the message is they do not. So please take advantage of that. So I think, Drew, for me, marker is a modest marker of let's double that number and just know that we're making progress going forward.
Yeah, absolutely. We'll have to see what the data shows at maybe at the start of next year or sometime next year, what happens in this year's open season. But Director Ahuja, I know, you and I think it's just important to point out that you and other FEHB experts have kind of said, at least what I've heard is that, it would never be the expectation that, 90 or 100% of people make changes. It's just, at least taking a look, thinking about it, and then making changes if that feels like the right decision for you. But of course, I think it would be a little bit too big of a thing to, say that we'll ever get that much, but just at least to take a look, right, is the big takeaway here.
Yeah, right. That is absolutely the message here, is whether we stay at 5% or we go to 10% or something more. The point is that you've heeded this message that there are changes every year to your plan. It behooves you around making sure you have the right coverage, the cost savings. You're looking at FSA Feds and FedFIP to complement, how really holistically, what do you want your coverage to be? Or maybe you haven't opted for FEHB in the past and you'd like to take a look and see what plans and what coverage they provide going into 24. So really appreciate you help us getting the word out. And thank you so much for caring about these issues and making sure our employees and their families have all the information that's going to be helpful for them. And, which is a very important kind of life event, which is making sure you have the health coverage you need.
Absolutely. Well, Director Ahuja, thank you so much for joining me today. It was great to hear from you.
Yeah, likewise. Take care.
I'd like to thank today's guest. Kiran Ahuja is Director of the Office of Personnel Management. I'm your moderator, Drew Friedman, and you're watching Federal News Network. Now let me send you back to the studio for more on the open season exchange.